What is prostate? The prostate is a small, muscular gland in the male reproductive system. Your prostate surrounds your urethra and makes most of the fluid in your semen. The muscular action of the prostate helps propel the fluid and semen through your penis during sexual climax. What is BPH? Enlargement of the prostate is called benign prostatic hyperplasia, BPH. It occurs when the cells of the prostate gland begin to multiply. These additional cells cause your prostate gland to swell, which squeezes the urethra and limits the flow of urine. BPH isn't the same as prostate cancer and doesn't increase your risk for cancer. However, it can cause symptoms that can affect your quality of life. BPH is common in men over 50. Up to 50% of men between ages 51 and 60 have BPH, and around 90% of men over age 80 live with the condition. BPH causes. BPH is considered a normal condition of aging. Although the exact cause is unknown, changes in male sex hormones that come with aging may be a factor. Any family history of prostate problems or any abnormalities with your testicles may raise your risk for BPH. Men who've had their testicles removed at a young age don't develop BPH. BPH symptoms. The symptoms of BPH are often very mild at first, but they become more serious if they aren't treated. Common symptoms include incomplete bladder emptying, nocturia, which is the need to urinate 2 or more times per night, dribbling at the end of your urinary stream, incontinence, or leakage of urine, straining when urinating, weak urinary stream, sudden urge to urinate, slowed or delayed urinary stream, painful urination, blood in the urine. Talk with your doctor if you have any of these symptoms. They are treatable, and treating them often can help prevent complications. BPH diagnosis. When checking you for BPH, your doctor will usually begin by doing a physical exam and asking you about your medical history. The physical exam includes a rectal examination that allows the doctor to estimate the size and shape of your prostate. Other tests can include urinalysis. Your urine is checked for blood and bacteria. Urodynamic test. Your bladder is filled with liquid via a catheter to measure your bladder's pressure during urination. Prostate-specific antigen, PSA, test. This blood test checks for cancer of the prostate. Post-void residual. This tests the amount of urine left in your bladder after urination. Cystoscopy. This is the examination of your urethra and bladder with a tiny lighted scope that's inserted into your urethra. BPH treatments. Treatment of BPH can begin with self-care and lifestyle adjustments. If symptoms don't subside, medication or surgery may be recommended. Your age and general health will also influence the prescribed treatment. BPH natural treatment. Natural treatment can include specific actions or lifestyle changes that you can make to help relieve your symptoms of BPH. These include urinating as soon as you feel the urge, going to the bathroom to urinate, even when you don't feel the urge, avoiding over-the-counter decongestants or antihistamine medications, which can make it harder for the bladder to empty, avoiding alcohol and caffeine, especially in the hours after dinner. Reducing your stress level, as nervousness can increase the frequency of urination. Exercising regularly, as a lack of exercise can aggravate your symptoms. Learning and practicing Kegel exercises to strengthen your pelvic muscles. Keeping warm, since being cold can make symptoms worse. BPH drugs. When lifestyle changes aren't enough to relieve your symptoms, your doctor may recommend medication. There are several medications that can help to both treat the symptoms of BPH and BPH itself. These medications include alpha-1 blockers, hormone reduction medications, and antibiotics. BPH surgeries. There are different types of surgical procedures that can help treat BPH when medications aren't effective. Some procedures are either non-invasive or minimally invasive and can often be done in your doctor's office or clinic. Outpatient procedures. Others are more invasive and need to be done in a hospital, Inpatient procedures. Outpatient procedures involve inserting an instrument into your urethra and into the prostate gland. They include transurethral needle ablation, TUNA. Radio waves are used to scar and shrink prostate tissue. Transurethral microwave therapy, TUMT. Microwave energy is used to eliminate prostate tissue. Transurethral water vapor therapy. Water vapor is used to destroy excess prostate tissue. Water-induced thermotherapy, WIT. Heated water is used to destroy excess prostate tissue. High-intensity focused ultrasonography, HIFU. Sonic energy is used to eliminate excess prostate tissue. Urolift. The enlarged prostate is surgically lifted with the help of implants so that it doesn't block the urethra. Inpatient procedures include transurethral resection of the prostate, TURP. This is the most commonly used surgical treatment for BPH and remains the gold standard surgical treatment. Your doctor inserts a small instrument through your urethra into the prostate. The prostate is then removed piece by piece. Simple prostatectomy. Your doctor makes an incision in your abdomen or perineum, which is the area behind your scrotum. The inner part of your prostate is removed, leaving the outer part. After this procedure, you may have to stay in the hospital for up to 10 days. Transurethral incision of the prostate, TUIP. This is similar to TURP, but your prostate isn't removed. Instead, a small incision is made in your prostate that will enlarge your bladder outlet and urethra. The incision allows urine to flow more freely. You aren't always required to stay in a hospital with this procedure. BPH natural remedies. These natural remedies are debatable on whether these treatments actually work based on evidences. Saw palmetto. Saw palmetto is an herbal remedy that comes from the fruit of a type of palm tree. It's been used in alternative medicine for centuries to relieve urinary symptoms, including those caused by an enlarged prostate. A few small-scale studies have suggested that saw palmetto might be effective for relieving BPH symptoms. Saw palmetto is safe to use, but minor side effects can be upset stomach and headache. Beta-sitosterol. This herbal medication is a mixture taken from different plants that contain cholesterol-like substances called sitosterols or phytosterols, plant-based fats. Several studies have suggested that beta-sitosterol can relieve urinary symptoms of BPH, including the strength of urine flow. Some scientists have also suggested that it's these fatty substances like beta-sitosterol, which is also found in saw palmetto, that are actually doing the work. There haven't been any major side effects reported with the use of beta-sitosterol. However, doctors still don't know all the long-term effects of this natural therapy. Pygeum. Pygeum comes from the bark of the African plum tree and has been used in traditional medicine to treat urinary problems since ancient times. It's often used to treat BPH symptoms, especially in Europe. Because studies on it haven't been well designed, it's hard to know for sure whether it's effective. Some small studies have suggested the supplement can help with bladder emptying and urine flow. However, the studies reviewed were inconsistent. Pygeum does appear safe to use, but it can cause upset stomach and headache in some people who take it. There are no studies on long-term safety. Ryegrass pollen extract. Ryegrass pollen extract is made from 3 types of grass pollen: rye, timothy, and corn. A review of herbal studies found that men who were taking ryegrass pollen extract reported an improvement in their nighttime symptoms of getting up to urinate, compared to those who were taking a placebo. However, this study lasted only 6 months. It didn't look at how well the supplement worked compared to prescription medications. Stinging nettle. You'll know if you've accidentally touched the common European stinging nettle. The hairs on its leaves can cause a sharp jolt of intense pain. But stinging nettle may have some benefits when used as a medicine. Nettle root is thought to improve some BPH symptoms, and is commonly used in Europe. Currently, there's no strong scientific evidence to suggest that it's more effective than no treatment at all. Sometimes nettle is used in combination with other natural BPH treatments, such as Pygeum or palmetto. Side effects from nettle are usually mild, including upset stomach and skin rash. Foods to treat BPH. The role of diet in the prevention of BPH and in treating its symptoms continues to be explored. Researchers found that men with diets high in fruits and vegetables, especially leafy, dark vegetables and tomatoes, had less BPH, less symptoms of BPH, and were less likely to have worsening of their BPH. Researchers believe it's not just one nutrient, but rather the combinations found in a healthful diet and lifestyle that are beneficial. Takeaway: BPH doesn't always require medical treatment. Sometimes, your doctor will want you to have regular checkups to monitor your symptoms and the size of your prostate. Lifestyle changes, medication, and surgery are all treatment options for symptoms that are affecting your quality of life. Health is very important to everyone. Don't let other activities consume all of your time and energy. Proper awareness and attention to early signs of abnormal symptoms are keys to keep us healthy. Early treatment is always more effective than late emergency actions. May you stay healthy and have abundant of happy life. Please like and subscribe this channel for more health-related videos. Thank you.